Good afternoon. I'm here with Dr. Shah, with Mark Sloan, and Dr. Porsa of Harris Health as well. I'll speak first, I'll repeat the remarks in Spanish, and then we'll hear from them. Since late summer, there's been a deeply troubling loss in the momentum we'd begun to build as a community. Once again, reopenings took place before the numbers got to where they needed to be. And bit by bit, we've seen every indicator yet again move in the wrong direction. No one day-to-day change has been dramatic, but if you look at the trends, they're alarming and they're deadly. Since the start of the fall, late September, the number of average daily new cases we report in Harris County has increased 250%, from 253 to 635. In that same amount of time, the positivity rate has increased 30%. We're now back at 8.2% positivity rate, and remember, we never did hit 5%. With over 220 COVID patients in the ICU and over 500 patients in the general population, the COVID population in our hospital is tracking the trends we saw right before the crisis in June and July. Almost 1,200 people died in July, and our hospitals were full during that time. We've all heard the metaphor of the frog in boiling water. Well, we're here. I know we're more than 8 months into this crisis, and as a community, we've been beat up and bruised, we've grown tired, and we're hungry to get back to normal. It's human nature to get complacent, to want to give in, to be tired. That's normal. But we can't do that right now. We have a narrow window in this moment to turn this ship around and avoid what we saw in June and July, or much worse, what's happening in El Paso, what we're seeing in other areas of the country. But we need all hands on deck. This is in your hands, and all of us need to do more. Today, I want to urge every resident in Harris County to do two things. First, to cancel gatherings, large and small, unless you're with your household. This is simply not the time for gatherings and get-togethers with people you don't share a home with. Support businesses with takeout, through delivery. Look, we all have a desire to be together, particularly as the holidays approach, but we're in a war against this virus. Things shouldn't be normal when it's a time of crisis. And if things feel normal, we know we're doing something wrong. This is not the time to lament that we didn't get a gathering this time around. I know we don't enjoy that, but this is simply not the year. Number two is, please get tested. This virus may be invisible, but we can make it visible through testing. And the only way to find out everyone who needs to quarantine is by doing that. So I'm urging everyone, regardless of whether or not you have symptoms or you believe you've been exposed, to please go ahead and get tested. You can visit readyharris.org for all the free options, and there have been a lot more private options as well. Check with your medical provider and check Ready Harris as well. All of us should be wearing masks. All of us should be trying to social distance. I'm not going to minimize the importance of that. As you know, I'm a huge advocate for those things. But we need to stop pretending that masks and vague calls of social distancing are a silver bullet solution. The huge numbers in Texas, which has had a mask mandate, shows us that while helpful, just masks are not enough. And we've known that, we've said that from the very beginning. To emphasize how important these two steps are, later today I'll be sending a wireless emergency alert to every resident in Harris County, asking folks to stop gatherings and also directing them to the Get Tested link at Ready Harris. I understand this is a lot to ask of the community, but we've come together in the past as a community to respond to disasters, to win wars. That didn't come easy, and it didn't come without sacrifice, and so we can't expect it to be easy right now. We should be asking more of all levels of government too, not just of the community. That's why every 2 weeks at court, we pass measures to mitigate the impacts of the virus, why our public health staff works day and night to try and contain this. That's why we need the state to step in and lead or get out of the way and let us lead. That's why we urge the federal government to pass more economic relief for families and for the businesses that can't realistically operate as usual while also being responsible during a pandemic, simply by virtue of what they are. We need your help, each of your help, and it is my hope that these numbers nationally also usher in aggressive leadership from the state and federal level that finally breaks us out of a cycle of unsustainable reopenings and false hopes that has already led to needless deaths without delivering a stronger economy. Finally, I want to close with a quick thank you to Dr. Shah for your service to the county. Dr. Shah, as you may have heard, will be departing in mid-December to lead the Washington State Health Department. He's been a champion for investing in public health and preventative measures in communities before, during, and after these crises. Residents should know that services will continue uninterrupted. We're going to continue making sure that Harris County Public Health has the resources it needs to be supported, and we're all grateful to Dr. Shah for his work in our county and to his team. Let me repeat my remarks in Spanish. Desde finales del verano hemos visto una preocupante pérdida del impulso que habíamos construido juntos como comunidad. Nuevamente se llevaron a cabo reaperturas antes de que los números llegaran a donde debían estar, y poco a poco estamos viendo todos los indicadores moverse en la dirección equivocada nuevamente. Si vemos el cambio día tras día, no es drástico, pero si observamos las tendencias, son realmente alarmantes. Desde el principio del otoño a finales de septiembre, el número promedio de nuevos casos reportados diariamente por el condado Harris ha incrementado un 250%, de 253 a 635 casos diarios. En ese mismo espacio de tiempo, la tasa de positividad ha subido un 30%, ahora estamos nuevamente en 8.2%, y recuerden que jamás llegamos a 5%. Con más de 220 pacientes en las unidades de cuidados intensivos, más de 500 pacientes en la población general, la población de COVID en nuestros hospitales está siguiendo el camino de las mismas tendencias que vimos en junio, antes de la crisis en junio y julio. En el mes de julio, casi 1,200 personas murieron de COVID en el condado Harris. Y en ese mes y en junio también nuestros hospitales estuvieron llenos consistentemente. Podíamos llegar a ese punto o peor. Todos conocemos el dicho de la rana y el agua hirviendo. Y estamos ahí en este momento. Sé que ya vamos 8 meses de esta crisis. Como comunidad estamos cansados, estamos aburridos, tenemos ansiedad de regresar a la normalidad. Pero simplemente no podemos hacer eso. Tenemos tiempo limitado en este momento para realmente evitar lo que vimos en junio, en julio o algo aún peor. Este es el momento de tomar acción. Todos nosotros tenemos que hacer más. Cada individuo en la comunidad les pido que hagan 2 cosas. Primero, cancelen reuniones, grandes o pequeñas, a menos de que sean con personas con quien usted vive. Simplemente no es el momento. Apoye los negocios con comida para llevar, con autoservicio, pero por favor no salgan a reunirse con personas con quienes no viven. Todos queremos estar juntos, especialmente ahora que vienen las fiestas, el Día de Acción de Gracias, las Navidades, pero estamos luchando una guerra en este momento, estamos en momento de crisis, entonces no podemos estar viviendo la vida como si fuera todo normal. Si las cosas se sienten normales, es porque estamos haciendo algo mal. Este no es el año en el que vamos a tener todas nuestras reuniones, todas nuestras celebraciones, hasta que haya una vacuna disponible a toda la población. No vamos a poder regresar a la normalidad y simplemente tenemos que aceptar eso para proteger vidas en nuestra comunidad. Entonces ese es número 1. Número 2, hágase la prueba. El virus es invisible, pero podemos hacerlo visible a través de las pruebas. Entonces le estoy pidiendo a todos, tenga o no síntomas, crea o no que ha sido expuesto, que por favor se haga la prueba. Puede encontrar opciones gratuitas en readyharris.org, no se le pide seguro, no se le pide ciudadanía, y también hay muchas opciones privadas, entonces puedes revisar también con su seguro. Todos tenemos que seguir utilizando las mascarillas, practicando el distanciamiento social. No quiero minimizar la importancia de esas actividades, pero sí tenemos que dejar de pretender que simplemente el hablar en general acerca del distanciamiento social o simplemente el utilizar las mascarillas va a traer esto bajo control. Lo vemos en el estado de Texas, con números muy altos y donde ya hemos tenido una orden de mascarillas por varios meses. Las mascarillas ayudan, pero como hemos dicho desde el principio, desde la primera orden de los tapabocas, no son la solución completa. Entonces, hoy más tarde estaremos enviando una alerta móvil a todos los teléfonos de los residentes en el condado Harris. Esto es increíblemente importante y por eso la alerta va a pedir que por favor se cancelen las reuniones y que se hagan todas las pruebas. Entiendo que esto es mucho que pedirle a la comunidad, pero hemos trabajado juntos como comunidad antes para responder a desastres, para responder a guerras, a conflictos, y nunca ha sido fácil ni sin sacrificio. Tenemos que pedirle más a los miembros de la comunidad y también a todos los niveles de gobierno. Por eso cada 2 semanas en la Corte de Comisionados invertimos en medidas para mitigar los impactos del virus. Por eso nuestros trabajadores de salud pública trabajan día y noche para intentar contener este virus. Por eso necesitamos que el Estado lidere o se haga a un lado y nos permita a nosotros liderar. Y también necesitamos que el gobierno federal envíe apoyo económico para las familias y también para los negocios que no pueden operar responsablemente durante esta pandemia simplemente por la naturaleza de su negocio. Espero también que los números que estamos viendo nacionalmente invite más liderazgo más agresivo por parte del Estado, por parte del gobierno federal, y que por fin rompamos ese ciclo de reaperturas prematuras, de esperanzas falsas que ha llevado a muchas muertes innecesarias sin traer una economía fuerte. Finalmente quiero darle las gracias al Dr. Shah, que ha estado trabajando con nosotros durante esta crisis. Como saben, el Dr. Shah se va a retirar a mediados de diciembre para liderar el Departamento de Salud del Estado de Washington. Dr. Shah ha sido un increíble campeón de las personas, de la salud pública, de la salud de la comunidad en general, tanto durante esta pandemia como antes y después de cualquier crisis. Quiero que sepan todos que los servicios del Departamento de Salud Pública seguirán sin interrupción y estamos comprometidos a asegurarnos que el departamento tenga todos los recursos necesarios. Pero sí le quiero dar las gracias al Dr. Shah por todo su servicio y también a su equipo. Entonces, con eso cierro. Y ahora vamos a escuchar los comentarios del Dr. Shah. We'll hear from Dr. Shah and then Dr. Porsa, and we'll take questions.
Thank you, Judge. Thank you for your kind words and your continued leadership. It has been an incredible journey over the last 10 months that we have been in this pandemic, fighting this together. And I really want to thank you for all your leadership. I also want to thank our county leadership and all of our governmental officials who have worked together along with our community members to really fight this pandemic for all these many months. Dr. Porsa, always a friend and colleague. It's great to be with you. Mark Sloan, it's fantastic to always have you with your steady leadership in emergency management. And certainly I would be remiss if I didn't introduce Mr. Mac McClendon, who is one of our incident commanders for Harris County Public Health related to COVID-19 response. I just want to underscore what the judge said. It is absolutely critical for us to think about this in a way that we have not thought about this before. Yes, we have talked about the 3 W's of wear your mask, wash your hands, watch your distance, but it is the 4th W about the will for all of us to do those things, but also to be thinking about this from the standpoint of what's happening in our community. As you have heard from the judge, we are seeing increased transmission, increased cases in our community. We have a positivity rate that had, test positivity rate that had decreased and now is starting to inch up, and it is now over 8%. And we are also seeing increases in hospitalizations, not just in general beds, but also in the intensive care units of our healthcare system. And it is incumbent on all of us to do what we can to fight this pandemic. And we are tired, all of us are tired, and the judge has mentioned this, that so-called COVID fatigue. But I really talk about 2020 as, if you think about a football match or football game, it's the first half. And we have halftime that's coming up now, which is the holidays. And the holidays is, you know, with all the different things that all of us like to do during the holidays, of getting together and being with our family, being with our friends, and to be together. But we are still in this pandemic. And what we do during halftime, what we do during the holidays, is going to be absolutely critical for the path forward in 2021, which is the second half. And yes, vaccines are on the horizon. Yes, we are very excited about all sorts of news that we're hearing. But the very basics are twofold. Do the things that you can do. Wear your mask, wash your hands, watch your distance, get tested, all the things the judge said. But also during the holidays, this is the time for our community to really think of the holidays potentially as being risky behaviors. There are things that are happening during the holidays of being together at the dinner table or with our family, with our friends, people that we think are part of our social bubble, but they're really not, because it's really our family, our immediate family in our household that we need to be concerned about and be around, especially in those intimate settings. We have to be very careful of inviting those other people into our homes, in indoor settings, because when we invite people into our homes in indoor settings outside of our social bubble, guess what? We're also inviting the virus in with us, and we do not want to do that. So we are pleading with our community to do everything you can to really help us fight this pandemic. And Judge, you are right. We fought it successfully twice before. We did that in March and April, and we did that in June and July, but it took all of us as a community to do that. We are still in threat level red. We want to make sure our community is doing everything it can to help us fight this pandemic. I wanted to address something at the very end that the judge said. You have all undoubtedly heard the news, and I want to thank everybody for the kind wishes that I've received. I am starting a new chapter in my journey and my professional career. I'm honored to be joining Governor Jay Inslee at the Department of Health in the state of Washington as the next Secretary of Health. I will be at Harris County Public Health through, as the judge mentioned, mid-December, actually through December 18th. And what I want to underscore is that it's not about the me, it's never been about the me, it's about the we, it's about our team. And the reason that Mac McClendon is here is because he represents that team. It is about all of us here. It is about all of us together, and it's never about one individual. So while I may be cheering this community from afar, our team is strong, it's capable, and it continues to fight the mission of public health for our community. But we can't take that mission on without your help. So please, during the holidays, do everything you can to avoid large and small gatherings, especially indoors. Do everything you can to watch travel and do all those things that are going to allow you and your family and your loved ones and ultimately our community to stay protected. Let me close by saying we have a lot of information on our website, but remember one thing before Dr. Porsa comes up. This is like a rubber band in our healthcare system. It can stretch, but at some point you can't stretch any further and the rubber band will break. And we do not want the rubber band to break, because what you are seeing across the state or across the country, we don't want that to happen in the community that we love, especially when we had the opportunity to prevent that. And so it is an honor, a privilege, Judge, to have served with you, and I want to say that your leadership is going to be something I'm going to remember and continue to be a part of and watch as I continue in my career. But I want to thank all of you, because ultimately the judge, myself, all the people up here, we cannot do anything unless our community works with us. So please work with us. Thank you so much.
Thank you. Thank you, Judge, for inviting me to have this opportunity again to share my thoughts with the community. But before I start, I also want to thank Dr. Shah for your friendship and for your leadership. What you've done in this community, I think this community owes you a debt of gratitude for what you've done. As I was standing here listening to the judge and absolutely echoing everything the judge said, I remember, it seemed like a lifetime ago, I was standing here and I said, Houston, we have a problem. It was toward the end of March, April, when New York was having all the problems, and I asked the community to help us to please flatten the curve. Give us, the health service providers, the hospitals, the time to get our surge plan in place, to get our PPE supplies in place so that we can take care of you. And you all did that successfully, gracefully. And I thank you for that. Then we had the June and July situation. We had a huge surge. Our health system was tested. The rubber band was stretched. We came close to having the rubber band broken. We came too close to being inundated with patients and overrun with patients. Luckily, we did not. We came close to it, but never got to that point. Right now, it's no mystery. You all have seen the numbers on the TV and the radio and the newspaper. We are getting an increasing number of new COVID-19 cases in this community. That is the bad news. The good news is that we are not getting as much of our patients in the hospitals. There is a reason for that. The data is showing that there is a younger segment of our population right now that is getting infected with COVID-19, the 20 to 40-year-olds, the young adults, the adolescents. They don't tend to get as sick. They're not coming to the hospital. That's great, even though our hospital numbers are going up. As you can imagine, we now have a groundswell of a lot of COVID-19 cases in this community, waiting for a super spreader event to occur to completely turn the table on us. We are right now at the threshold of that event, the Thanksgiving holiday. Somebody asked me, is Thanksgiving is going to be the next Memorial Day or 4th of July? Thanksgiving holiday actually has the potential of being a lot worse than what happened in Memorial Day and 4th of July, for the simple reason that we have a lot more cases of COVID-19 in our community right now. When that younger segment of the population goes home to gather with the parents, the grandparents, the aunts and uncles, the older segment of the population who tend to not do as well with COVID-19, that's when things can really change very quickly. And that's the reason that I'm here, the judge is here, Dr. Shah is here, asking you to please continue this fight. There is light at the end of the tunnel. Vaccine is coming, not for a few months, not widely available for everybody, but it is coming. We need this next 6 to 8 weeks of dealing with COVID-19 virus for us to be able to get to the point where we have the vaccine available for general distribution. Really important. Please take the advice that the judge gave about not gathering for Thanksgiving holidays. If you absolutely have to gather, please get tested before you gather. Please self-isolate before you gather. If you have to gather, please keep the number of people in the group to a minimum, ideally less than 5, absolutely no more than 10. If you have to gather, please move it outdoors. If you have to gather, please provide enough social distancing. If you have to gather, please continue wearing your face mask when you're not eating and drinking. Don't gather around the dinner table. If you have to serve, do it individually, one person at a time. Use disposable utensils so that not everybody touches the same utensil. Wash your hands before and after you serve your food. do the common sense things that are going to impact the result of the gathering. Again, don't gather. That is the best thing to do. If you have to gather, please remember those words that I said, so that after the Thanksgiving holidays, we can have a great Christmas holiday, and then the New Year, as Dr. Shaw said, the second half of this football game, we can have a better outcomes. You know, the way I describe it the other way is, you know, in June and July, in June we were driving at 40 miles an hour, and all of a sudden we got in trouble because we went to 120 miles an hour. Right now, because of the pent-up COVID cases in this community, we are driving at 90 miles an hour. It's not going to take us much to get to that 120 miles an hour and get in trouble again. And that's the reason for all this advice. Let me thank you again for what you have done so far to get us to this point, avoiding the disasters that we have avoided, and asking for your help again to help us avoid another disaster in terms of creating a super spreader event during the Thanksgiving holidays. Judge, thank you again.
Thank you, Dr. Porsa. Dr. Shaw will take questions now.
We have a couple here from 13, Judge. The first one being, on Friday, El Paso County lost its court case over its shutdown order. Knowing this, does this mean you won't attempt a shutdown in the future here in Harris County?
We've been watching, obviously, the litigation very, very closely, and we're always keeping all options open. What I'm focusing on right now is two things. First, making sure that the governor's office is aware of the numbers we're seeing and how pretty much exactly they're tracking what we'd seen in June. And second, being very clear with the community. I don't want to get people caught up on what authorities there are or are not, what litigation happened or didn't happen. The reality of what's going on in the ground right now is our numbers are very high, our trends are all looking consistently heading in the wrong direction, and so what folks need to hear right now is stop gatherings and get tested. And so I'm going to use the platform that I have, the voice that I have, but of course we're looking around and trying to keep options open.
Another one from 13 here. It says that during the State of the County, you said, we now know another pullback is necessary. It's going to be coming soon, I'm sure. What do you mean by a pullback, and what measures are you considering, and what point would the region have to reach in order to for that to take place?
We've been at threat level red in Harris County. The reason we're back where we are is, you know, we've been discussing this for months. If you open everything pretty much as things are right now, before the numbers get to where they need to be, and in an arbitrary way rather than based on consistent metrics, you are going to see the types of increases we're seeing. And so I think it's very likely, if trends continue, unless folks take the steps right now that we need them to take, there's going to have to be some sort of action. And that's why I'm consistently trying to show the state, the numbers we're seeing, but most importantly, going directly to the community. I know it's hard, and it's hard to do it when you're not getting that leadership from the state, the federal level, and the best that I can do is be very clear with the advice and the requests. And so that's why right now, all is not lost. We are at a point in time where if we stop gathering with people that we don't live with, if we all go get tested, well, we can avoid that. But if the trends continue, that's not going to stop on its own. I am concerned by what's happening in El Paso and seeing that they've got no recourse. You know, that they're having to pull up those mobile morgues, that folks are, hospitals are overwhelmed. Stories of tragedy. I don't want that to happen here, and that's why we're having this conversation to try and avoid that fate.
¿Podría hacer los comentarios en español sobre la primera pregunta de la situación que enfrenta El Paso y la orden que trataron de emitir, pero después pues enfrentaron esa resistencia por parte del Estado?
Sí, obviamente las opciones todas están sobre la mesa. Hemos estado observando las demandas en El Paso. Estoy haciendo dos cosas. Primero, siendo muy clara con el Estado, con la oficina del gobernador, en los números que estamos viendo y el hecho de que nuestras tendencias todas exactamente se ve lo que veíamos en junio. Y número 2, pidiéndole a la comunidad directamente la acción que necesitamos. Si seguimos viendo estos números, tenemos en algún momento que tomar acción, algo va a tener que cambiar. Pero en este momento estamos todavía a tiempo de poder nosotros como individuos, como miembros de esta comunidad, de poder evitar una crisis como la que se está viendo en El Paso. Entonces, no quiero confundir a la gente hablando de qué autoridad hay o no hay, qué demanda está vigente o no está vigente, todo eso es política. El punto fundamental es que hay que cancelar reuniones con personas con quienes no vivan y hacerse la prueba. Es muy triste lo que estamos viendo en El Paso, que están teniendo que traer camiones refrigerados para los muertos, que los hospitales están completamente llenos. ¿Podemos evitar eso acá? Con la falta de liderazgo a nivel estatal, necesitamos a nivel de individuos poner de nuestra parte. Y si siguen estos números, tendremos que seguir pidiéndole al Estado que nos ayude a tomar acción adicional, pero estamos con el tiempo necesario para cambiar esta trayectoria. Esas son las buenas noticias.
Another question here from KHOU. Why do you believe sending text alerts to residents telling them to get tested is needed? And do you believe not enough people are currently getting tested?
Absolutely. You know, we're seeing the biggest commitment that I have is to use every tool at my disposal. And for one, it's being able to communicate with all residents in this county transparently and consistently about what's happening. We've got a narrow window to turn things around. And one of the best ways to reach them is through these text alerts. So I'm not going to avoid the use of a tool that we have at a moment where action or inaction could make the difference in our community between a fate like El Paso or the ability to turn this around. So that's why we're using this tool. Not enough people are getting tested, and we see that by virtue of the positivity rate. You want to get to a positivity rate of 5% at least, ideally even lower. And when you're doing that, that's not necessarily an exact measure of who all is positive in the community, but that also tells you whether there are enough people getting tested to where you're capturing all the positive cases. The fact that our positivity rate continues to rise and is now well beyond 8% tells us that not enough people are getting tested. We do have capacity at our public health sites, at our Houston health sites, and of course, plenty of capacity in the private sector as well.
Another one here from KHOU. Last week you criticized what you called half measures by state and federal leaders in fighting COVID-19. Do you believe that the state should scale back reopenings, and by how much?
Absolutely. I mean, look, we've been seeing history repeat itself over and over again. We lived this already in March, and we had it under control. It looked like in April we were getting to a point where if we just stuck with it, we would have gone to a much better place. And then cases went up again in June and July, and then again we flattened the curve, and then here we are for the third time. So obviously what is happening is not working. And the economy is not doing much better than the places that have managed to bring this under control. So what we need to do is adopt an enforceable threat level system like the one we've been proposing in Harris County that lays out a series of metrics that doesn't pick and choose the one that happens to look good at the time. Because the state started with cases and then moved to hospitalizations and then went to positivity rate, and now it's back at hospitalizations. We can't pick and choose metrics. We got to collect parameters, thresholds, and stick with the restrictions until the numbers look better. And once we get there, open only a little bit, not open everything, because inevitably what you're going to see is this. What that will achieve is two things. Number one, it'll get us out of this faster. We've been at it for 8 months. We could have dealt with it and gotten to a new normal in April or May. And number two, it'll also make sure that we're saving lives. 1,200 lives, over 2,000 lives lost in Harris County already, that people that did not need to die. And finally, it's a better way to get our economy on track. When folks feel safe, there's that confidence to have a new normal. We're not going to have everything open as if there was no virus, but you can have a more consistent new normal if you have a handful of cases versus 634 cases a day.
And have you since then had any discussions with Governor Abbott and his team? And if so, what reaction did you get?
We're working with the governor's office consistently. Our staffs, they know, he knows my perspective on all of this. And that's why I'm going to the community to say, you know, we can't wait for action. I'm not going to push the community until the hospitals are overwhelmed and we lose 1,200 people in a month yet again before we do something. So that's why I'm here today pleading with you all. That's why I'm sending that emergency alert. We have a chance to turn this around. We are not powerless against this, but we've got to work together. We've got to recognize that this is not the year, nor will it be at the beginning of this year, to have a great holiday gathering, a great outing at the bar, the restaurant. It's just not the time.
¿Podría abordar un poco las últimas dos preguntas sobre esta reapertura? La considero un poco prematura y hay alguna manera en que también tal vez considere que se tendría que cerrar nuevamente la economía en alguna parte?
Ya hemos visto la historia repetirse 3 veces. En abril controlamos la primera curva y después el Estado reabrió todo, subieron los casos. Junio y julio nuevamente logramos aplanar la curva y se volvió a reabrir prácticamente todo y ahora aquí estamos otra vez por tercera vez con los números hacia arriba, consistentemente. Entonces sabemos que esa estrategia no está funcionando. Lo que hay que hacer es adoptar una serie de parámetros consistentes, con medidas consistentes y no reabrir todo, sino poco a poco basado en lo que dicen los números. Es esencialmente el sistema de nivel de amenaza de coronavirus que hemos propuesto aquí en el condado Harris. Eso es lo que espero en un futuro. Sería ideal que pudiera ser tanto el gobierno estatal como el gobierno federal. Lo que han hecho muchas veces en el gobierno estatal es primero se enfocan en los casos, cuando los casos se están viendo el número pues mal, entonces empiezan a ver las hospitalizaciones, la tasa de positividad, nuevamente a las hospitalizaciones. Escogen la medida que pinte una imagen positiva, buena, y basado en eso abren absolutamente todo. Esa estrategia ha llevado más de 2,000 muertes en el condado Harris y nuestra economía aquí no le está yendo mejor que en otras áreas donde sí han podido controlar el virus. Entonces no se trata de la economía o el virus, eso viene junto. En este momento espero que la comunidad pueda manejar esto entre nosotros. Obviamente el gobernador sabe mi posición, nuestros equipos trabajan juntos consistentemente y él conoce los números que estamos viendo, pero yo no puedo simplemente esperar a que otra vez se llenen los hospitales, a que otra vez veamos alta cantidad de muertes antes de tomar cualquier acción. Entonces por eso el día de hoy estoy pidiéndoles a todos que cancelen reuniones, que se hagan la prueba y nos ayuden a que estas tendencias, estos números se mejoren.
And the last question here, can you talk a little bit about Dr. Shah's loss and are there any plans to begin to replace?
We're very committed to making sure that there's continuity in Harris County Public Health. We are in the thick of this crisis, and the most important thing is to make sure that we're still providing our residents the services that they need and getting smarter and getting better. And so we're going to be working with the commissioner's offices to appoint an interim director, to launch a national search, and to work with the strong team that is there. But we all wish Dr. Shah the very best. He's going to be here aiding in the transition before he heads off to Washington, and we're all more than prepared to make sure that things continue consistently. Thank you.